Today is day one of renewed negotiations between Mercy Health St. Vincent and striking workers. Both sides are back at the table together for the first time since this strike started 2 weeks ago. I-Team reporter Sean Haggerty live with what's at stake and what legally happens next. Sean.
Yeah, Diane, this is probably the best opportunity we've seen in the last 2 weeks to get this issue resolved, as a federal mediator is now involved to try to get those roughly 2,000 workers back to work. Could these striking workers in front of Mercy Health St. Vincent Hospital have a connection to a recent teacher strike in Arizona?
There was a bit of an uptick last year with the successful teacher strikes. Now that is in some ways a very different profession, but in the other way, it is a profession that has skilled professionals working with people, serving the public. Those strikes were successful, and maybe that was an impetus for the strike or other strikes.
University of Toledo law professor Joseph Slater says that while the number of strikes have decreased, teachers have had success recently. He's not involved in these negotiations, but knows a federal mediator can be a step toward a deal.
The mediator does not have the power to impose a settlement, but the skilled mediators are often pretty good at getting them.
We do know replacement workers are inside St. V's doing some of the work of the nurses, technical, and support workers who are now on strike. Slater says what happens to everyone after a deal is reached can be complicated.
Now, the employer can decide that these will only be temporary replacements, but the employer also has a right, because these nurses are striking over economic terms, staffing issues essentially, the employer has a right to permanently replace them. That's not 100% the same thing as being fired, because if the replacement were to leave the job, the nurse who was replaced could take their job back. But if the replacement stays, it can be effectively a lot like being fired.
It is very remote, but a government agency could get involved in order to end this strike. Slater says if it goes long enough, the Federal Mediation and Conciliation Service could step in and end the strike if the agency determines that it is creating a real problem for health care in our area. But Diane, we are told that that is a very rare instance that will happen, so we'll certainly keep an eye on the situation.
All right, Sean, thanks. And no details of today's negotiations have been released. It is expected that both sides will be back at the table tomorrow.